Today we will talk about hematocrit and ESR. ESR stands for erythrocyte sedimentation rate. Hematocrit, another name is packed cell volume. It can be abbreviated as PCV. So this PCV, it represents the volume percentage of RBCs that are present in the blood. The value is different in males and females, as the RBC count it is different in both. In males, it is around 47%, whereas in case of females, it is around 42%. Now, how do we get this PCV or hematocrit? Heparinized blood. Heparin, it is an anticoagulant. When it is added to the blood, and that blood, heparinized blood, it is centrifuged in a tube, test tube. There is separation of blood in several layers. RBCs, they tend to collect at the bottom, leaving the cell-free plasma at the top. We had discussed the same thing in our first lecture in the composition and functions of blood, that RBCs, they settle down at the bottom because of their higher specific gravity, and a layer of plasma, it is left at the top, and in between these two, there is a layer of buffy coat that includes WBCs and platelets. Now, why do we need this PCV or hematocrit? It is required for the calculation of red cell indices. These are the indices that indicate the health status of a person. We'll talk about these indices. Secondly, the index of RBC mass and consequent hemoglobin concentration. It is a very significant factor. Okay, so PCV, it serves as an index of RBC mass, and as the RBCs, they contain hemoglobin, the same is being reflected by PCV. We had discussed about the normal count, so there must be certain condition in which the count is increased or decreased. PCV, it is increased when there is dehydration or when there is polycythemia. We had talked about polycythemia in the previous class, in the previous lecture. Now the PCV is decreased when there is loss of blood, depression of bone marrow, destruction of RBCs, and in case of anemia. But there are certain conditions when we get false high values also. It is seen in case of sickle cell anemia, hereditary spherocytosis. Hereditary spherocytosis, as the name suggests, hereditary. So it is a congenital condition. Spherocytosis, red cells, they become spherical in shape instead of their normal biconcave shape. Now about ESR. The full form is erythrocyte sedimentation rate. So the meaning, it lies in the name. Erythrocyte, RBCs, sedimentation, settling down, rate, it is the rate. So the rate at which the red blood cells, they sediment or settle down when whole blood is allowed to settle. Okay, so red blood cells, they tend to settle at the bottom because of their high specific gravity. Okay, so what is the principle for this? When the anticoagulant mixed blood, it is made to stand in the narrow vertical tube, as you can see here, then RBCs, they settle at the bottom, as these are heavier, specific gravity is more than plasma, and the rate of settling of these RBCs, it is recorded at the end of 1 hour. Okay, so it is calculated by two methods. First method is Wintrobe's method, in which the blood is allowed to settle down in Wintrobe's tube. In males, it is around 4 to 6 mm in first hour. Females, it is around 0 to 14 mm in first hour. Another method to estimate ESR, it is Westergren's method, in which the blood is allowed to settle in the Westergren's pipette. In males, value is around 0 to 4 mm in first hour, and in females, 0 to 8 mm in first hour. Now about the stages of ESR. The process of settling of RBCs, it takes place in 3 stages. stage 1, in which there is Rulix formation. What is Rulix? As you can see here, the red blood cells, they tend to pile up or aggregate as if the stacks of coins. You can see here, they have piled up like coins, stacks of coins. And this stage it lasts from 10 to 15 minutes. Rulix formation, it is followed by stage 2, in which there is sinking of these stacks of red blood cells to the bottom of the tube. This is the longest stage. Duration, it is from 40 to 45 minutes. This is the slowest phase. And the last stage is stage 3, in which the piles or the bunches of RBCs, they get packed at the bottom of the tube. And it lasts for around 10 to 12 minutes. Now, what is the significance of estimation of ESR? Always remember, it is not a diagnostic test. It is a prognostic test. What is the difference between diagnostic and prognostic? Diagnostic, you directly reach to the diagnosis. You can tell, okay, the patient is suffering from tuberculosis, arthritis, etc., etc. It is prognostic. It can tell whether the patient is improving or the health is deteriorating. Cause may be any. So when the ESR is increasing from its normal value, it shows that the health of the patient is going to deteriorate. But if there is fall in the ESR, okay, it is moving towards normal, that means the patient is showing improvement. So we can say ESR, it is an indicator of damage to the tissues and inflammation. If there is more inflammation, ESR will be increased. If the patient will improve, it will come back to its normal value. So there are certain factors. Okay, there are certain factors in which the ESR is increased or decreased. It can increase during pregnancy. These are the physiological factors. Pregnancy, menstruation. Normally in females, it is more as compared to the males. If a person stays at high altitude for a longer duration. Regarding some pathological conditions, ESR can be increased during infection, inflammation, and in case of anemia, but not in case of sickle cell anemia, pernicious anemia, and hereditary spherocytosis. And fall in ESR, it is seen in case of males as compared to females, the ESR is lesser. Infants, they have lesser ESR. Polycythemia, sickle cell anemia, pernicious anemia, hereditary spherocytosis, and hypofibrinogenemia. ESR is decreased in these conditions. So that was all about hematocrit and ESR. In the next presentation, we will discuss about red cell indices and osmotic fragility. Thank you so much for listening to the video.